Live to our 3rd and 4th years in residence, and actually anybody with the YouTube link. You're so far back, we need to move our panelists up here. But anyway, thank you so much for coming. I know probably the main reason you came was free food, but I think that this is a very important topic, and I think you'll find that as well. We have some great physicians here that are going to introduce themselves, and we'll get started with that.
Can you hear me now? Okay. I'm Dr. Moulton. I'm an OBGYN. I think I've met most of you, especially the second years. I think you're really excited about my slides and how brief they were, if I recall correctly. But I'm happy to be here. And one of the things is physician burnout and achieving resilience. But I really hope that it's interactive, because we talked about this as chairs last, I think, December. And one of the things that I can tell you is when students come and talk to me, be it on their 3rd or 4th year rotation or their 1st or 2nd years, I can tell you whose students, their parents are physicians, or they have someone to bounce ideas off. Because oftentimes I'll see people that get so worked up over things about the future, be it the debt, or can I pass 1st year, 2nd year, how do I get a residency, yada, yada, yada. Do I have to be number 1 in my class, or what have you? So I want you guys to be able to ask questions on everything. Yeah, you're going to get burned out. You're probably burned out as a 1st or 2nd year right now. So open this up, and really I want you to, especially for those people that don't have a parent or an uncle or an aunt that's a physician, ask any question that you want today.
I'm Dr. German Burbell. I'm general surgeon over at KU and chair of surgery over here. So I think I've tortured you guys at one point or another in the last year or two. So welcome. And like Dr. Moulton said, this is really an opportunity for a topic that is huge right now in medicine. I mean, this is all, and we'll hear about that here in a second. This is one of the big topics that all the conferences are talking about at our level. You think you guys are burnt out. Come talk to us. Ask us the questions, and hopefully we can help you with that.
I'm Sarah Hahn. I'm a neurologist, and I teach those of you in 2nd year, you know who I am, and beyond, following us by Skype or web or whatever we're doing. Burnout is a huge issue in neurology. We, as a field, are at the top. We're in the top 3 or 4 disciplines within the profession of medicine where burnout is a very serious issue. At least 1 in 2 neurologists will experience serious burnout in their lifetime. Several of my colleagues through the American Academy of Neurology are working extensively to study this, how we mitigate it, not only at our level, me practicing 20 years, as some of my colleagues several years as well, but how we begin to address it and prevent it actually from your level. So it is a big issue. I agree with Dr. Moulton. We certainly want to answer whatever questions you have. We are free game to ask anything you want to ask. But this is certainly, to start with, an issue about resiliency and how we prevent burnout in medicine in general.
Well, I think everyone is, okay. Good evening. I think everyone here has painfully or not experienced my lectures and so forth. I'm Dr. Carol Carrillo. I'm faculty here with the Internal Medicine Department, and I'm honored to be included in this panel. Again, I can't encourage enough open discussion and dialogue. We talked about it for a long time during that dinner meeting, and there wasn't a lull in the conversation, but we don't want it to be us talking about it. You guys are experiencing, and those of you on the internet and so forth, it happens every phase of your training, and we want to help you through it currently while you're here at school as a 1st and 2nd year, but we also want to give you some tips and tricks for the future, but answer whatever questions you have. And this is a personal session, not an educational session. So there's no judgment involved. So if you have a little offbeat question, we're good with that. I like those.
Hey everybody, Kevin Hubbard. I am the chair of medicine, and I'm also the chief of the division of specialty medicine And it's great to see you all here. So I'm kind of thinking as we look around the room tonight that a few of you have an interest in this. I think there was about 165 of you who signed up. We've got some more folks watching tonight through YouTube. And so I think it's a testimonial. I think you all are an example of the issue and the problems that we've got. The people who are on this panel, and Dr. McGowan, who's floating around here someplace, these are all my professional brothers and sisters. This is family. And so when family members are struggling with personal issues that deal with a lot of burnout, when they're getting tired and when they're struggling, I think as a family member, you feel compelled to want to reach out to them and to help them. Likewise, every one of you in this room, and those of you who are watching on YouTube, you're members of our family. This is something that we feel that we need to be talking about more and more. It's an issue that I think is very germane to the practice of medicine. And if you've been following along with DO Magazine, you'll notice that probably about the last 3 or 4 editions of DO Magazine, they have talked specifically about issues relating to physician fatigue, physician burnout, physicians being disgruntled and disheartened by the practice of medicine. So this is something that has our attention at every level professionally. And so I appreciate you all being here. There are no stupid questions. There may be a stupid answer or two, probably from my end of the table, but that's okay. We're all going to be here together and we're just all going to talk. This is a skull session, so just feel free to go for it.
Dr. McGowan?
All right, so right now we're going to go ahead and open it up to any questions that you guys have. Anybody have any questions right off the bat? Nothing? About as much crickets as usual?
Yeah.
Okay.
If you guys also want to write the questions down, if you don't feel comfortable asking it, then we can pass those around as well.
That's a good idea. That's a very good idea.
Oh, I'm Chris Erickson. I'm one of the second-year students here. I went to the DO Day on the Hill yesterday, and obviously one of the big topics that came up was the like physician suicide and everything, and how stressful, like what we're talking about tonight. And I guess it's more of just an idea, but what can we do to where was I going with that? What can we do to like help prevent that in us students and stuff?
I'll figure this out by the end of the session here. Basically, as far as physician suicide and all that, it's probably is a burnout reason. When you guys get out, there will be some times that you'll have great opportunities, but you also have to look at your lifestyle. I recently, in the last year, was involved in something that's called a Physician Leadership Institute, and it was a year-long commitment, and multiple physicians were involved, from neurosurgeons, trauma surgeons, et cetera. And it over the series of years, we did several different meetings. And one of the meetings, they were just talking about your family life. And one of the things, we got to know each other really well. And these were from different physicians in the Kansas City area. It was a pilot study, and just to kind of bring us together and come together and kind of learn about the business aspect of medicine, et cetera. Well, one of the sessions they were saying is, all right, everybody stand up. And by this time, we all kind of knew each other, so it didn't feel that uncomfortable. And they were saying, who right now, and they asked a whole bunch of questions. And one of them said, who doesn't have a best friend? Like right now, if you had trouble today that you could call outside your spouse, step in the circle. And there was probably the majority of physicians stepped in that circle. So not saying that they are going to commit suicide or what have you, but I think right now you guys are studying every day, 7 days a week, et cetera. And you're doing that to hopefully better your life and better your family down the road. And so don't look for opportunities, but don't forget about why you became a doctor. You became a doctor to help people, and that also includes your spouse and your family. So you shouldn't go home at the end of the day feeling good that you helped everyone else, but your kids don't know you. You've never seen them play baseball or basketball, or weren't even in a situation that you could be a coach. So I think really that's where that burnout comes from, is don't chase the almighty dollar, because it's out there and you can work 365 days a week, or a year, excuse me. So I do, yeah, if they do 365 a week, then look at your pay stub. Something's going to be off on that. So that's where I would kind of put my 2 cents in.
One of the things I always tell the residents when they come on service, especially as interns, is surgery is a cruel mistress. It's 5 years, and she takes everything away from you. Takes your family, takes your life, takes everything. So finding that balance and finding the way to understand what you're wanting to become takes a lot of resiliency, takes a lot of inner strength, because at the end of the day, do it because you want to do it. Don't go into surgery, don't go into neurology, don't go into ER, don't go into a specialty because you think, wow, I can make a lot of money and I can do shift work, or I can, end up buying the top house, or I can drive the fancy car. Because if you really don't like what you're doing, residency is 5 years in surgery, plus any extra years for subspecialty. It takes a minimum of 5 years to establish a practice. You've already invested 4 years in medical school. So you're 14 years behind the guy who lives next door to you, who basically opened up his own business after getting out of college. Okay? And a lot of people feel that need to catch up. So you're in this because there's a calling, there's a feeling internally that, wow, this is what I really need to do. And that needs to continue as being the focal point of why it is that you continue to do what you do. So you're going to make a comfortable living as a physician. There's no question about that. But if that's your primary goal, you're going to burn out very quickly, especially if you go into one of the more, intense, more stressful type of residencies and careers after that. So keep that in mind.
I agree with always choosing time over money. And those of you who know my practice know that it is exceptionally busy. We are one of the busiest neurology practices in Kansas City, if not the busiest. There have been times where my other senior partner and I, our waiting time for new patients is between 3 and 4 months. If you think you have epilepsy, if you think you have MS, if you think you've had a stroke, if you think you have Alzheimer's disease, that's a long time to wait to see somebody. We have always tried to work people in. We've stayed exceptionally busy. But one of the things that my partners have always done, I'd like to say I came up with the idea, but they were already doing it when I came 20 years ago, is we always take a half a day off a week. When you get up before the sun comes up, you're working, and you don't leave and go to the parking lot in the hospital until the sun goes down, week after week, month after month, year after year, I would say that's stressful. What would my colleagues say? It's really stressful. Could I have made more money if I worked in those half days? Sometimes those half days weren't at noon. Sometimes those half days started at 2 or 3 in the afternoon. But I always knew I was going to have a little bit of time to myself, to my husband, to my kids, to recenter myself. I think all of us up here would agree time over money. That's a big factor, right? Would we all agree that that's a huge factor? And all of us have seen colleagues that didn't make time the more important over money. And there are a lot of things that can drive you to change that priority. Sometimes a spouse expectations. If you've been married to somebody who's lived with you through that 5 years plus the 4 years of med school, lean years, sometimes they have expectations, and sometimes the expectations don't manifest in a way that that is what they want. So I would say, for one thing, be careful who you choose as your life partner. I have seen that not infrequently in both male and female physicians who ended up choosing somebody that probably was with false expectations, and it makes everybody miserable. The other thing that I would say, really to answer your question more, is what are the factors that lead somebody down the road to an end of something horrible like suicide? One of the things that I see, I've served at very high levels in the large hospital that I work in, where we've had to address all kinds of things. One of the terms that's used is depersonalization. Anybody familiar with that term and what we're talking about? I think it could be interpreted two ways. It's usually used as a term when physicians start in the burnout, down the burnout road, they no longer see their patients as people anymore. It's just another person that has to be seen and get them in and out of your office or the hospital, get in and out of their hospital room and get the work done and get out. That's not a good place to be. I think all of us, I will admit to having been at that edge sometimes when I'm at my most tired. Anybody else been close to that sometimes when you're really tired? And so you have to be able to recognize that in yourself and don't go down that road. Substance abuse is a huge issue among physicians, nurses. I have seen it in my staff in my office. Fortunately, I've never had a partner that I know of that has had that issue, but I've had to deal with it in close colleagues many times. That pattern, I am convinced, starts college or medical school. When you get done with a horrible set of exams and you're done and you think, I'm going to get plastered tonight, that is probably not the best way to handle stress.
Dr. Hahn, he wanted to clarify, I'm right here, what he wanted to ask. You can finish your thought if you were still going, but he did kind of remember what he wanted to clarify with the question.
Yeah, sorry about that. So yesterday, kind of the main thing was like bringing awareness to DOs in the first place, in our place, in not only Missouri, but the United States and the world, I guess. My actual question that I was thinking of was a physician career is not normally a career that brings a lot of sympathy to it. We've heard that, well, I've heard that from several physicians. So what can we do to bring awareness to the mental health of the physician? And that it's kind of the same question you guys are already answering, but so that was my actual question, but thank you.
Yeah, I think it gets to a self-care sort of issue. There are things that we can do here at the university. We've got 2 full-time clinical psychologists to talk to people, to counsel people, to give them advice and things that they can do to improve that. They will probably tell you that they're very busy in their work, because I think the challenges that you all face here are substantial in nature. You all come from very different backgrounds and you sort of bring that individuality with you. Some people may be a little bit better adept and a little bit better able to deal with that stress than others. And so sharing with each other little tips and tricks and strategies can be very helpful. But having professional people who are available to provide that additional support is really valuable. I think the comments that Dr. Moulton, Dr. Burbell, and Dr. Hahn have made are very appropriate in terms of thinking about how you manage this when you leave here. It only feels like this is going to last forever. It really, really won't. And the second years realize, man, those board exams are getting really, really close. And then before you know it, we're out of the chairs, out the door, and we're actually out there rotating with physicians as third-year students. And so things change very, very rapidly in medical education. It just seems like it's going to last forever, especially if you're still recovering from heme and lymph. So trying to get past those things and realize that there is a future means that you have to develop some adaptive behaviors. Unfortunately, the reality is that you also develop some maladaptive behaviors. You are a lot closer to a lot of controlled substances than any of the patients that you will treat. You're a lot closer to it than the nursing staff, the occupational and physical therapy staff, the front office staff. You're very, very close to this, and you know the tricks, and you learn very, very quickly how to conceal things. that becomes an impairment issue when you start taking care of patients. And so the concern is that if we can address the issue of burnout, address the issue of suicide, which ultimately is an overstressed, overwhelmed individual, if we can start addressing some of those things now, we not only can lower the problem level and help de-escalate this a little bit, but we can create in every student a sense about how you manage this when you get out of here and you go out into residency, when you go out into practice. Finding things you love, finding balance in life, those are all very, very essential components.
You mentioned the comments that physicians have made and about it not being a sympathetic potential for this profession, because we are often looked to for sympathy. That's part of what burns us out because we get drained. So you have to fill your cup back up. Now, what does that for each person is highly, highly individual. Sometimes you can get together with friends and there's commonality. But one thing that I wanted to really mention is that it struck me, we don't accept sympathy very well either, because we are the ones that are supposed to be the helper, the healer. We're going to fix it. And my sister even tells me about how I'm a fixer at home. I mean, just, and that's our nature. And it's also our nature not to admit weakness. And that starts before you even get in these rooms. So the personality profile that kind of brought you to this point is the kind of personality that you're always the strong one. You may not talk to people, you may not reach out to people, or you may not accept if they say, you look like you're hurting. Can I talk? Can we talk? So you need to also be aware that you might want to accept those offers occasionally. And with that, I will turn it over to Dr. Hill, who has just recently arrived from his very busy psychiatry practice, which is a real welcome addition to this panel.
Rule number one, don't overextend yourself. And rule number two, when there's a delirious patient and they're yelling at you, leave the building and don't step in, because it ends up being another 45 minutes. Well, I know it's finding, balance is, I am a shrink, but, this word balance drives me crazy. But because what you guys are going to be doing, what you're doing now and taking care of people, you almost have to fight to find some sort of balance. Whatever that level is for everybody is different. It's not going to be working 8 hours a day and going home and then coming back in and starting it again, because what we do is just we carry a tremendous amount of responsibility, and it will wear on you if you don't have outlets. Some of us like golf, and some of us like music, whatever. But I always tell people that if you can find 5 to 10 minutes a day where you can just go and decompress, whatever meditation you can do, that helps take the edge off of that day, because people are going to be asking you to do things right and left, and you're going to want to help, you're going to want to fix. And what you have to learn, and I'm still starting to learn this better, is to say no. And there's going to be people, your patients come first, your practice comes first, your hospital work comes first, but there's going to be a lot of people that want you to do things for them, freebies here and there. You got to learn to say no, and it's okay to say no. It really is, because if you don't, it will wear you down, and you won't find that balance. Those of you who have families, the hardest thing in the world is to be a significant other for a doctor. I mean, you think being a physician is hard, that other job is even harder. So, and lean on them. It's fine. Go home and vent for your little bit, short period of time, and then they'll tell you, okay, enough venting, let's talk about the kids and everything else. But, the balance is not 50-50, because you go into medicine for patient care, and you sacrifice a lot for that. And if you accept that, that's fine. But you're going to have to take that time to retool and refuel. I try to do it as much as I can. We all try to do it. Uh, Electronic medical records sure as H don't make it easier. There was a recent article that in one of them, I think, Annals of Internal Medicine, which talked about you spend an extra hour per day per patient at times doing charting and everything at home. So you got to learn to be efficient. Learn to be efficient. I can't emphasize that enough. You get a routine, stick with it. And as you're doing your residency, once you find your routine, stick with it. And it may take 3 or 4 tries, but you have to get in a routine, especially with electronic medical records and taking care of patients. And don't let the distractions, distract you during the day. And you're right. If you need some counseling, go get it. There's nothing. Everybody sees a psychiatrist nowadays. It seems like, trying to get in to see a shrink, it's about a 4-month wait. Obviously, people are getting help, and counseling to me is even better because it's an hour. You don't need pills half the time. You need skills on how to manage your time. So there's your balance. It's not going to be 50-50, but as long as it's a level that you're comfortable with and you have a quality of life that you're content with, and your family will know, because when you're irritable and biting at everything, they're going to know that there's something off, and that's when you stop, decompress, talk to somebody, and then get right back on the horse. Anybody else?
So I've seen about 3 other questions, so we'll start up here with John.
So this is kind of a follow-up. Dr. Hill kind of answered it there. I was just wondering, with the very busy specialties like surgery and neurology and psychology, what are some things that you all have done to find that balance with your family and your work life?
Have a 5 and 3-year-old. That'll definitely break your hold on thinking about medicine every day. It's different. Everybody has their own strengths. Everybody has their own thing. You actually know what I do to decompress from surgery scheduling and operating on patients and having to deal with an EMR and all that. I teach. I come over here and we cut open the cut suit. We open up cadavers. I decompress in ways that I found help me, which is, it's very individualistic. I played golf, and for 5 years I was in a surgical practice that we all played golf, and guess what? It never helped me. It helped all my partners, but it never helped me. So at the end of the day, it's like, what am I doing here? And so you end up looking for those places where you decompress. So it's very individualistic, okay? And it can be, try to make it outside of medicine. When I teach, I'm not thinking medicine, I'm thinking teaching, which is different. It's teaching medicine and anatomy, but it's different. So you want to look at something outside of medicine that kind of clears the cobwebs, kind of gets you focused on who you are as an individual. And 5 3-year-olds, that's very stressful.
I would also say, and I think this is mentioned a few times prior, is it upsets me when I hear a student say, oh, I want to go in this field because all I have to do is shift work. I don't have to carry a pager. Okay, I will tell you a personal story. My father and my mom were divorced when I was 2, so I grew up without a father. And if you said, well, what was a good field for me to go in if I want to be a good father, you would never pick OBGYN. You would say, why would you be an obstetrician gynecologist? I went on my rotations thinking, I want to be a family practitioner. And, in small town, I really believed that. That's what I wanted to do. When I got out, I loved OBGYN. I loved the surgery. I loved everything about it. You get the ER exposure. But I found a practice that allows me to work basically 3.5 days. And so that's what you can have out there. So find something that you love, kind of like what they're saying, is if you love something, but you have to do it every day, day in and day out, it eventually becomes a job. So find a lifestyle that you also can enjoy your family or what have you. I've met a lot of people that say, oh, my hobbies are my work. But at the end of the day, you've got to retire. And at the end of the day, you want to bring more to that and more to your patients. I mean, if that's all you can talk about is your work, with your patients, you're not going to connect with them very well. And that's what I'd have to say on that is don't look at being a doctor as, oh my gosh, you're going to be burned out. Kind of what he was saying. You come down here to teach. That's what we loved about medicine. That's why we go into medicine. You get that feeling back of, hey, it's not EMR. We don't have to do all that stuff. We can actually teach a surgery or make a difference. And like this last Saturday, I did over in the anatomy lab, did a couple cadaver surgeries, and it was fun. It was not so much tension and all that. But I love my job. I'd pick being an OBGYN every single day. And one of the things I also want to say, there's no difference between you guys sitting there and us, other than maybe 2 or 3 or maybe 20, 30 years, what have you. So don't beat yourself up about it, and don't let any attending act like, oh, you can't get through this. You're going to be up here pretty soon, and you're going to be able to do this. If you're smart enough to get in and you're sitting in the seat right now, you can do it.
Yeah, I would totally agree with that. And like Dr. Moulton and Dr. Burbell, I would agree. Teaching is it's a passion, it's a joy. There's this gee whiz naivete that you all bring to this. It's the first time you've seen something. It's the first time you've learned something, and it's all fresh and new. And because of that, it's all fresh and new to us all over again. So, I might have lectured on acute leukemia 25 or 30 times, but to see you all wrap your brains around it and really understand it and comprehend what it is, that's very uplifting. If leukemia can be an uplifting sort of thing, but the experience that you all have, we get to relive that, and it really means a lot to be able to have that interplay and that interaction with you, to see you all really grasp something. It just really warms our hearts. In hematology, oncology, hospice, palliative medicine, it sounds like I just said 3 really buzzkill words, didn't it? You really got to have it together, and you've got to find avenues to recreate. And in addition to teaching, my family is my passion. As you all have probably heard, I became a grandfather about 6.5, 7 weeks ago. So some poor kid has to deal with me as a grandpa. So that's exciting. My family is really where I get a lot of that. And I'll tell you a quick story about that here momentarily. Other things, music, martial arts, photography, those are things that I like to do. I'm not a golfer because I couldn't see how walking around for 3 or 4 hours swearing at a little white ball would help me relax. But a lot of you are, and that's a wonderful hobby to have. So, I do those things where I get a chance to use the right side of my brain and I can be creative. That really is a way to recharge and refill, as Dr. Carilla says, refill yourself. The other was my family, and before I came here a little bit less than 5 years ago, for 20 years I was in private practice north of the river, always was involved with the university, always had students, taught all the way through, but I was in private practice. And I remember being in private practice about 14 or 15 years. And for those of us who do consultative work, your busiest days are typically Mondays and Fridays, because Monday everybody wants you to come by and see the folks that they couldn't get in, couldn't deal with over the weekend. And then on Friday, they want you to come by and see everybody before the weekend, because there's about 20 million people who want to go home and they're waiting for the consultant to drop by. So those are typically our 2 busy days. And so I was in the office usually Friday afternoon until about 5 or so, and then usually would have at least 2 or 3 consults to go back to the hospital to do after hours. And I remember getting home about 9:30 one night, which was pretty typical for Friday night. Between 8 and 9:30, I'm rolling through the door to start my weekend, and my wife said, very, very innocently, she said, we haven't had a date out in almost 15 years on a Friday night. And she didn't say that to be hurtful. She didn't say it to be mean-spirited, but it just cut through me like a knife. You dummy. This is the most important person in your world. How could you have let this happen for so many years? 14 years? You haven't been out on a date with your wife on a Friday night? That's unacceptable. She didn't feel like she was saying it to be hurtful or spiteful, but I heard it. The following week, I went in and told my office manager, from now on, I want to be out of the office by 2 o'clock on Friday. Well, she says, why do you want to do that? And I said, because I know I'm going to go back and do 2 to 4 consults, and it's going to take till probably 5:30 or 6 to get that done. I want to be able to sit down and have dinner with my wife on Friday night. And she said, well, I'm not sure how that's going to work. I said, you don't understand. This is my practice, not yours. This is my decision, not yours. This is an issue, and it's going to happen. It's making those adjustments and making those people a priority in your life that really changed that focus. And I really felt like that helped with some of the pressure. Just a willingness to change a little bit what I was doing in order to be more available to the family.
You know, keep in mind, you're not going to be doing any of this until you're out of residency, because you know you're a slave through residency. But to kind of expand on what Tony was saying, you know, he loves OB-GYN. I love psychiatry. I went in, I thought it was going to be infectious disease. My master's degree is in parasitology. So, you know, I went from one end to the other, obviously, when it comes to psychiatry. But, you know, think about it. When you go into your field, if it is your passion, that will make it better in terms of burnout. But at the same time, just like Kevin said, set limitations. And, you know, do what you do as your passion, but set limitations as well. And that, for whatever kind of balance you have, that will work. You know, we love what we do in our terms and in our specialties, and it is our passion, which does help prevent a little bit of burnout, unless you don't set limitations where it becomes your hobby. And could I do medicine 24/7? I could. I really could. Well, I think we all kind of feel that way, and it is scary that it's like, man, I could do this all day. It's like in your blood, but you have to set the limits. And you know, for me, I mean, music is a big part of my life. Do I have time to play a lot? If I get home and I grab my acoustic guitar and I play 15 minutes, I'm ready. Yeah, I'm ready for the rest of the day. Whatever hobby, have a hobby, and find time for it. But you know, make sure that you always know that if you're. And a doctor told me this years ago when I was applying to med school. He goes, no matter what happens at the hospital, no matter what happens with your practice, if something happens at home, you get home. That's your first priority. And no matter what is going on, if there is a crisis at home, if your family needs you, that's where you go. And or a date after 15 years, one of the two. Yeah.
I want to just add quickly to that. One of the reasons I have this lovely book in front of me is that across my desk yesterday came a lovely article in what's called Continuum, which is kind of the Bible according to neurology, and summarizing a bunch of articles and studies that have been done from Mayo. Knows I practice my craft. I didn't for a number of years. And what I found, and this is the best way I can describe it to you in music, is that my world suddenly became in color again, rather than black and white when I went back to music. I was a better physician, I was a better mom, I was a better wife, and I felt a lot more complete inside. So if you say to me, who are you? Yes, I'm a neurologist. I'm also a human. I'm also a musician. I have a lot of hats that I wear. One of the things that was found in several of these studies is that some sort of art form made a difference. Mm-hmm. I am convinced as a neurologist, looking at music, looking at art, looking at other things, for neurologic disease, Alzheimer's is at the top of the list. We use our neurons differently. Maybe Todd has seen some of this in psychiatry. We know that there's still a lot unknown about the brain, but we know that we use neurons differently when we look at art, whatever that art form is, especially music. So if you can't play anything and you can't carry a tune, you can always learn to play an instrument. You can go to whatever music events you love. Make sure you put them on the calendar and do your work around that.
Yes.
Get your other partners to take call. Do something so that you are doing that yourself. Yeah, question. Somebody has questions.
Lots of questions going
Okay.
on.
Well, we can't see the hands. We can hardly
No,
see you
no,
guys.
I want to let you guys all have chance to talk, so that's why I've been waiting. So if you're ready, we'll go on to additional questions.
May I just make a comment too? We keep talking about do what you love. Well, a lot of folks in the journey, how do you know what you love? And even especially as first and second years, you haven't necessarily even been out in the world to have your hands get into things. Dr. Burbell does his best to help you get there, but there are a couple of tips. Number one, if there's any particular topic that keeps you awake when you're reading it, and for me, keeping me awake while I'm reading is phenomenal if it happens. So that's one tip. The other tip is look at, and especially here on, you can do it here on campus or in shadowing experiences and volunteer experiences, but also as you get out on rotations, look at the attendings that you gravitate to, that you seem to just click with and get along with and feel a camaraderie with. And you'll notice that difference as you're on the different rotations. And what that tells you is a lot about your own personality, that if you're clicking with those kinds of people, then perhaps that might be a good fit for you. If you've narrowed it down to a couple, 3, 5, 20, whatever you want to call it, areas, the very next most important thing is to look at the lifestyle and what you want out of the rest of your life, and family expectations and all of the other things that we've talked about. So let's move on to more questions. Oops.
Excuse me, just a little context. I was talking with an orthopedist maybe 6 or 7 years ago when I was in college, and he said the biggest mistake he saw was people always saying, well, once I get there, then I'll be able to
Yeah.
do blank, and that there is no there is kind of what he was trying to tell me. And I've thought about that a lot just personally, and it's been tough to rationalize as I see my loan balance go up. So I was just curious what you guys were thinking about this concept of paying back loans and how to still feel like you're empowered over the decisions that you make to try to stay in the moment and live on a day-to-day basis, when at the same time, how aggressively you pay back loans versus paying them back over the long haul, but having that, impact savings for kids' college educations in terms of compounding interest. And those are really complex things. And that's what spooks me the most about burnout, is just feeling like, boy, I'm defeated. I'm sort of damned if I do, damned if I don't.
Is there anyone else on this panel who's still paying on their student loans? All right. Okay, good. That makes me feel better.
Yeah, I'm still paying on my student loans.
I
and
thought sure there wasn't. But
I don't even want to say how long I've been out in practice, and I'm still paying.
I won't tell. I won't tell. Things happen. You have to refinance because some other mega event in your life happened. But as was said before, you will make an incredible income no matter, even if you get the lowest paying physician job. You will still make more than enough to have a very livable lifestyle and to pay those debts off. And one of the best gifts I did for myself was I put it on direct payment from my checking account, because I have an income that I can rely on month to month, so that I know that I may not be able to pay 5 other bills, but I can pay that one. And it's sort of like those Christmas savings accounts, you don't even miss it. And it's like, I can't think about that as my priority in life, so.
You got to look at it in many ways. Medical school teaches you how to be a doctor. It doesn't teach you anything about the real world. So as soon as you get done with here, you're going to accrue a debt that nobody else in this country accrues. I mean, we don't come out of college with $150,000 worth of debt. You're going to be restricted in your ability to pay that back for 3 to 5 years because of your residency gain potential is minimal. Okay, you're going to be getting minimum wage in residency. You don't get paid the big bucks, and the longer your residency is, the shorter your potential for improving your income becomes, and therefore the quicker you can pay that off. Okay, so once you're done with residency, you have to start a practice. So do you start join a multi-specialty group? Do you start your own practice? Are you hospital-based or are you clinic-based? Those are all decisions that impact your ability to make a living, because if you join a multi-specialty group, you'll be the younger partner. So you're definitely not going to get, the top salary. You'll get a nice salary, but you won't get the top salary. So now you're starting at the bottom trying to work your way up. The financial ramifications of medicine nobody talks to you about. We don't teach it because very few of us have actually any knowledge of financial ability. I mean, I went into medicine because I hate math. I failed calculus twice in college. Okay? So this is not, I'm not the math guy in the family. Okay? So what I've been telling students and what I tell residents is, coming from the fact that we are all doers and we like to take care of patients, first place you have to do is take care of yourself. So unfortunately or reluctantly, I have started to take some business classes. And what they all talk about is your business plan. What's your business plan? Well, in 2 years I want to be here, in 5 years I want to be here, in 10 years I want to be here. That's what all companies do. They all have a short-term goal, they have a mid-term goal, and they have a long-range goal. You guys are now in a position where that's where you need to start looking at. When in 15 years, when you get in the car, where are you going? Are you going to a hospital? Are you going to a private practice? Are you academic? Are you, where are you? Are you in the Midwest? Are you in the East Coast? Are you in the West Coast? You start making that plan. My family, we're going to have 2 kids, 3 kids. Okay, in-law, far away from the in-laws? Yeah, far away from the in-laws. Okay? And you start making that long-term plan, because then that helps you kind of set, well, what's my mid-range plan? Well, my mid-range plan is I want to go into this residency because it's going to give me, the chance to basically have this type of practice. And so what's my short-term plan? Well, I got to pass boards. Okay? So as you start getting into that mindset, you start looking at your long-term goals, the financial aspects of that come into that. And you start, I would say, if you guys haven't already, get, and I know the school does, start having interactions with financial planners now. Goes without saying. Not just because you want to set up a college fund for Joey, but because where do you want to be in 15 years when you're getting in that car? There's ways of taking care of that. There's loans that you can take to reduce the interest rate. I never bothered. My interest rate was at 4%. So why should I even try to refinance that? I can't get anything lower than that. So yeah, I'll pay it. It's $250 a month that I've been paying for the last 25 years. Okay? Just let it ride. I don't care. It's not changing. Okay? So those kind of planning sessions probably need to start happening a little bit now. And that is something outside of your realm, so that has to be with somebody that's outside of medicine. That's a financial planner, a banker, somebody in the family that understands business can also help you with that.
And as you'll see when you start to apply for jobs, one of the attractive things now, because there's such a shortage of physicians, some of these places offer loan paybacks. When you apply for a job, a lot do. I mean, I get tons of emails every day on job offers, and they have loan payback options. Not a bad idea. There are those programs where you work here and be a fee for 2 years, and they pay back your loans. I don't think I've ever seen a colleague who did that and regretted it. So something to keep in mind.
I want to kind of, I'm sorry, were you done?
Yeah.
Okay.
Never.
Couple things. One of the things I thought your question was outstanding in that you were saying this delayed gratification. You wouldn't be sitting here if you didn't understand delayed gratification. Back in high school or in college, we'll go to college. You had some friends that had a different degree. They weren't getting a BS in biology. They were doing something that's a lot easier. They're going to bars and dollar drink nights, Thursday nights while you're studying, trying to study for the MCATs. So that's kind of when we're talking about that delayed gratification. And so one of the things we're kind of talking about all the bad things a little bit about it. Business and finances is not that hard. If you go to a financial advisor and they say, you're a doctor, that's all you're going to do. We're just going to manage your stuff for 1%. Sit down with a compound calculator and count out in 10, 15 years of what that 1% is going to be. It is huge. It's probably $400,000 or $500,000 to you over your life. There's a great books out there that you can start reading. There's White Coat Investor. I don't know if you guys ever heard of it. It's an ER doctor, outstanding. Boggleheads webpage are outstanding. You don't need to hit the home run. So if you're doing day trading and all that, you've already hit the home run. You're going to have a big debt, but you also have a big salary. When I got home, back to Kansas City for my residency, 100% true story. I was out and I had got a pre-approved to get a loan, okay, for a house. My wife and I, they flew us back for the weekend. So I called a realtor and said, I want to see 22 houses and I want to do it in a day and a half. They're like, oh my, you can't do that. I said, I'm buying a house. Can I see 22 houses? And don't try to force me to say, oh, go look at the closet or this. If we walk in, we say we don't want it, we don't want it. So bottom line, say, oh yeah, okay, we can see 22 houses. So we didn't really end up seeing that many. But long story short, when we were in the car, he kept on saying, how come you're not using the Bank of America loan? And I said, well, I got pre-approved cap fed. It was a friend of ours. He kept on saying a couple times, well, you're the first doctor who's never used a Bank of America loan. Why are you doing that? I think, is he getting a kickback or why does he keep on talking about Bank of America? I had not even worked one day. I was still in residency in my private practice. And finally I said, what's the deal with Bank of America? And they said, oh, you're a doctor. Bank of America does this physician loan. You don't have to put any money down. You know, they go out because you're not going to default on your loans. So yes, your loans are going to be high, but don't forget, you're going to make good money when you get out. So I called Bank of America on the phone, gave them some information, what my starting salary was going to be, and they said, we're going to call you back. And they called me back 20 minutes. Oh, yeah, you're pre-approved. I said, well, how much am I pre-approved for? Whatever you want. And I said, well, like, do you think 400, 500? Can I go $1 million? Yeah, whatever you want. You're a doctor. So if I didn't learn my lesson there, it would be horrendous. We found a house, and my next door neighbor to my left was Kweku Mitchell. For any Kansas City Chiefs fan, he was a defensive linebacker. 2 houses down was Bo Richter, Mark Bo Richter. A lot of the people in the neighborhood weren't doctors. There are some sports figures there, and these aren't really grandiose houses by any means, but they're nice homes. A lot of people from Sprint and some upper executives. 2008 came, and the market tanked. Guess who stayed in the neighborhood? And Mark Bo Richter blew out his knee, never played again. Kweku Mitchell, he got hurt, and he went. Actually, he was traded to the Giants, and they won the Super Bowl the next year, so he did pretty good, I think. But bottom line is the doctor stayed. So the average salary, or an income, I should say, in the United States for a family of 4 is what? Anyone know? What a family of 4 usually can live on? It's about $55,000 to $60,000. So think about that for a second. Yeah, you're going a lot debt, but there's people that the most people can do 55. That's a family of 4. So don't get too hung up on your debt, but just don't go additional stuff on that. If you want to pay off your debt right during residency and when you're out and live like a resident, go for it. Absolutely, that would be the smart thing to do. But I would say Total Money Makeover by Dave Ramsey's outstanding book. And then the Bogglehead's Guide to Investing is outstanding. You don't need a financial planner or they will take advantage of you 100%.
I live in the same house I lived in as soon as I left my residency. I made a third at that time of what I make now. I've intentionally stayed in the same house. It's not with a whole bunch of doctors around me, but it's a very nice neighborhood. I chose that so that I could still put the maximum on my retirement account, some extra in my retirement account, take a vacation every year, have a healthy savings account. I have seen former partners, I have seen many physicians who live paycheck to paycheck. One of the guys in my residency, an attending, once said, whatever you make, you spend it. And I thought, how can that be? I'm sitting a measly residence salary. How can that be? He was right. And so it's a matter of intentionality and looking at, what's okay? How can I be comfortable but maybe not have the biggest house in the neighborhood? Because you're going to have a lot of bankers. Tony's story's kind of out there with whatever you want, but they will approve you for a lot of money, and it's probably more money than you want to spend on a house and things like that.
Yeah. The people who loan money, if they think you're a good risk for whatever reason or whatever imagination they have, they will help you absolutely dig the biggest hole you can possibly dig. That's their business. It's nothing personal, but that's why you have to be mindful about setting the limitations and those priorities about what really matters to you and your family. The other thing is, if you have other debt, for instance, I had to finance a lot of undergrad through credit cards and so forth. That's high dollar debt. That's high interest loans. Pay all of that off before you fixate on paying off your student loans. Because typically, even now, they're quite a bit lower interest rate.
I just want to add one thing here because I do like a lot of finance. I read a lot of that. That's my decompression for some reason. I don't know why,
Not
but
me.
I do love that.
I have a
that
financial
stuff.
planner you can trust.
Okay. Don't believe her. I'm joking. I will say doctors and lawyers are the two most professions that are poor accumulators of wealth. What is a profession that generates a lot of millionaires other than small business owners? Is a plumber. And you think, what are you talking about? If your plumber came in and they said, do you see my new vet out there? You would be like, I'm not using you. You're going to overcharge me. But doctors want to live in fancy neighborhoods. They want to have fancy watches, a new car, couple wives, a lake house, what have you. Really bad idea. Okay.
All right, we got a question up here.
Yeah, hi. Just curious to know, I know it varies, everybody's different, but would you guys comment on which phase of your career you guys experienced the highest level of burnout or stress?
All of them. Because it changes. You have different stressors in medical school that kind of get you to that point. You've got residency, which gets you certain level of stress and, factors. First 5 years of practice are different in that you're establishing yourself. You don't learn everything in residency. The residency gets you ready to go into the real world, but the first 5 years, you're finishing your training, and there's no safety net. So there's a little bit of a stress level there. You're establishing your home, what you're doing. The second 5 to 10 years, you're in the middle of your practice. So now you're dealing with the business aspects of it. You're dealing with the ups and downs of bringing in a partner, losing a partner, hospital's in trouble, hospital closes, relocating, better job. You're kind of in that middle ground there. Family is growing, financial responsibilities, those kind of things. And then you start getting towards the latter part of your practice, where now you're looking at, what's my retirement? What am I going to do? You're looking at changing practice patterns. I mean, when I started, there was no such thing as an EMR. So now you're having to adapt to the newest and latest technology. We didn't have computers. Everything was paper charts. So now, throughout each phase of your career, there's going to be different stressors and different burnout points, okay? You notice that none of those are actually having to deal with patients. It's not the patients that burn you out. It's not what you're doing that burns you out. It's all the things around you that put external pressures on you that make you feel like, I can't do my job. I can't take care of my patients. I can't do what I'm really supposed to be doing. It's taking me away from that. So that's where the balance comes in finding, how do I interact in this world and still do this in this world? Does that make sense?
Yeah, and I think in follow-up to that, as you go through your educational process, you go through your training, and you enter practice and go through your practice years, having that ability to adapt to the stress, to manage the fatigue, to find creative ways to recharge your battery is really important, because it will be changing dynamically with you as you go through these sorts of things. And so you might find, for example, that what worked in one part of your career doesn't seem to be as effective in another part of your career. I know a lot of people who, say, well, when I was a student, I'd just go out and run 3 or 4 miles. Now they've got an artificial knee and they can't run. So they got to find a way to do something a little different. So maybe they don't run, but they like to go for a nice walk. Well, you've adapted a coping mechanism in order to do it. It's a simple example of a very complicated issue. But being able to adapt to the stress is what makes you successful in terms of managing that stress and managing the burnout. Don't be afraid to open up to other healthy, legal, ethical and moral ways to de-stress, and be willing to try something that you may not like. You know, maybe you're not a big fan of collecting coins, but you try it out and you find out you really like it, and it really is a nice way to de-stress. So be open to those things as you go forward.
I still think the first 2 years of medical school is awfully doggone stressful. And I'm sympathetic to everybody in the room because I think all of us would say that's just a time, that's the now and the not yet. You have to get through it. You have those boards to face, and you just want to make sure you can kind of get there. So I think there is still, to me, it's a big hump. It's a big hump. I will also say for myself that being pregnant and being a medical student and a physician was not easy. It wasn't easy. I was pregnant in my 4th year. That wasn't too bad. But at that time, we didn't have any planned time off at all. And so I had a C-section and came back to rotations at 2 weeks.
Oh my gosh.
That was hard, but I did it. And then I had my second child after I'd been in practice for 2 years. I was covering 3 hospitals. Weekends, I was seeing 20, 21 consults a day. I was standing for 16, 17 hours. The fatigue was overwhelming. That was really hard, but I got through it. I had another C-section and went back to work at 2 weeks when my partner called and said, I need help. When I was an intern, at that time there weren't limits on how long you could be up and working and all that. I did my internship at UMKC, Truman and St. Luke's. And Carol and I were together there. And those were hard nights.
Yes.
And I had a 6-month-old who didn't like to sleep at home. So I was up at night at the hospital, and I was up at night at home. And those were hard days. So there's stress at every level, and you just, a lot of it, you just get through it, and you just say there's light on the other side, and you find healthy coping mechanisms. You know, it's interesting, one of the things we haven't talked about is what other fields do. You know, we're kind of late to this party. My husband is a pastor, and, you know, the first thing they tell them as they're getting ready to leave seminary is you need to have somebody on the outside of your congregation or wherever you're doing your ministry that you decompress with. And so almost all, you know, high-level pastors will have at minimum a spiritual life coach, if not a PhD psychotherapist, that they meet with every 6 to 12 weeks just to talk about what it's like to take care of people. You know, a really good nephrologist one time, I asked her when I was a medical student, what's the most stressful thing about your job? And she was an excellent nephrologist. And she said to me, I thought she was going to tell me time, hours, missing stuff with her kids. She, you know, she was married, she had kids. And she said to me, without even thinking, you know, she said, without hesitation, the responsibility of taking care of people's lives. And that is a heavy responsibility. And so you're always going to have that. It's not that it's a specific patient. I mean, yeah, we all have the patients we'd rather not see maybe, but when you're, especially if you're doing longitudinal care, you know, neurology is longitudinal care. I have some patients I've had for 20 plus years. You know, nephrology, same thing. Sick people, you can't always fix what they have. You're walking their journey with them, and you're responsible for them. It's a caretaking profession at the ultimate level. And so, again, Todd says don't be afraid to have, you know, therapy, that sort of thing. I agree. And we probably should be talking to each other more about that. You know, we're expected to be superhuman, and none of us is.
I've got a couple questions over here. First one.
Hi there. I've had a chance to rephrase this question in my head for a while now, and I'm afraid that it might come off as unintentionally provocative. It's not meant to be. Maybe it's just the former public health professional in me, but I'm more concerned with the upstream causes of physician burnout as opposed to downstream prevention, which I feel the context of today's panel has been. So my question is more about, is there something inherent in the culture of medicine that is wrong and that we should acknowledge that leads to physician burnout? I mean, is this just an inevitability that you will be so thoroughly, exhausted that burnout is inevitable. I mean, I absolutely hear you when you say that you know uh, you should only go into this if you're passionate about it, because no amount of money in the world will probably keep you in it. And I think most doctors do go into medicine for the right reasons, which is why you see these amazing feats where doctors are going emergency room residents, despite being paid a pittance, still go to the emergency room during blizzards and stuff. But my question is that even so, 50%, close to 50% of physicians report being depressed, and specifically asked if they could go back and do medicine, would they still do medicine? And 50% of them said that they wouldn't. That is perplexing, and I think it would be naive for us to say that all of the 50% who said no, we're in it for the money or for any wrong reason. So that's why I think my question is unintentionally provocative. But is there something wrong in what we're doing? What are the big things that we can do right to kind of prevent burnout?
The problem is the expectation that is placed on physicians from ourselves and from the community. I mean, from the lay people. I mean, because let's just be honest. Who's the great physician? That's kind of where the lay people look at you. You're one step below God as a physician. And that's been traditionally the role the physician took. You were the confidant. You were as close to a priest or as close to God as anybody else could get. And that inner resilience, that inner strength is what your patients rely on. So that expectation has always been there. You cannot be infallible. A physician that has, mortality rates above 1%, nobody goes to see him because you're not a doctor, you're a killer. I mean, we cannot be wrong. We have to get it right every time. Every patient, we cannot be wrong. That's a lot of responsibility and a lot of burden to put on people. And so what happens when you hear news reports of a physician that kills himself or a physician that is sued for malpractice because he did something so onerous? There's something wrong with that individual. It's not that, let's look at what happened for the 10, 15 years of his life, what drove him to that, but he was just not a good doctor. I think we have unrealistic expectations of ourselves as well, in that, hey, I am one step below God, and I can fix this, and I can take anybody to surgery and put them back together, and doesn't matter, I can do it. And we isolate ourselves sometimes in that way of thinking. So it's both sides. What can we do? Well, internally, address the issue, and we're finally, as a profession, doing that. I mean, airplane pilots have been doing this for now 20, 25 years. They started. Military's even been doing it for longer, looking at how to, deal with stress in these kind of situations. We're just finally recognizing that there is a problem, that the fact that we have 50%, right now I've got a 5 and 3-year-old. I hope they don't go into medicine. That's not the right attitude, okay? So I think recognizing, one, that there is an issue, and now starting these conversations, starting to look at what can we do at y'all's level, because at the end of the day, this is where the change happens. We're too old. At this point, we're set in our ways. So if we can start changing how you guys perceive the profession, not that it's a punch clock kind of thing, but that there are limits to what you can do, that there are limits to what you know, that there is limitations to abilities. That then starts to change the perception within the profession, and hopefully then that starts changing the perception within the community.
Yeah, I think medicine, just in follow-up, I agree with everything Dr. Burbell said. Medicine historically has been a zero tolerance profession. There is no tolerance for anything or any situation where anyone would waver. You're expected to perform at 100%. And that's true in the business of medicine too. If you get patient satisfaction surveys that score 95 to 98%, you'd think that'd be a good thing. That's a terrible thing. If 2% of the patients in your practice are dissatisfied with the care you get, that news travels. They talk about it at the barber shop. They talk about it at the hair salon. They talk about it in their house of worship. They talk about it in their social groups. You know, I really wasn't happy with this doctor. If that office takes care of 100 people a day, 2 of those people are dissatisfied, your practice will be doing well to survive for a year. That's awful. But that's the zero tolerance mentality that we all have been brought up with, that we have lived with for generations, and that society has placed on us. So I think to answer the question, we all have to change, but we have to also change the culture as well. It is unrealistic to expect human beings to conduct themselves in any way that's unhuman. They're expecting superhumanity from humans, and we're not able to do that. We're just as human as the people we take care of. We have the same failings, we have the same frustrations, we have the same hopes, the same desires, the same fears, and the same problems as the people who are walking through the door and asking us for help. And we infrequently ask for help from each other, and we infrequently reach out to people who are in positions to help us when we're struggling. And so owning the dialogue, owning the discussion, opening up the doors is part of changing that culture.
Hi, thank you guys for being here today. My question is, no one really, we were kind of talking about a little bit earlier, but no one really prepares you for the things you're gonna miss, I feel like, in medical school. You know, I always heard you drink water out of a fire hose, or the pancake analogy, but, you know, weddings, best friends, first pregnancies, things like that. One, I guess, does it ever really get easier to avoid missing those things or figuring out how to balance that? Or two, how do you kind of learn to balance that in the future?
So Microsoft Outlook has a great calendar if anybody really wants to. And I think you end up learning how to manage your time. I've got a 5 and a 3-year-old. My wife's a breast surgeon, so we're both basically extremely busy. She's actually with them today at swim practice. They're both learning how to swim. So I'm missing that one. But I take him to Taekwondo on Thursdays. So you start looking at what are the activities, what are the things in your life that are important to you, what are the things that you can't miss, and you start setting those parameters around it, and then you get very creative scheduling. Call in favors, call in friends, call in parents, call in family, cousins, whatever. You start looking at ways so that you don't miss those things. It doesn't get easier once you're out of medical school, or once you're out, and yes and no. In medical school and residency, it's not your time, it's the school's time or it's the residency's time. But then when you're done, it's your practice's time. So you have a little bit more control, but it's still, those demands on your time are still there. So it's a matter of you setting that as a priority. This is my sister's wedding. I can't miss this. What's going on at the time? And yeah, you may have to get a little creative with it, but at the same time, it can be done. It just takes a lot. It takes work. It takes effort.
Yeah, and knowing the emptiness that you feel when you do miss something is the motivation to do the creative scheduling. I had 2 kids in med school, and then in residency they were doing dance. I always tried to schedule, while I was going on call or time off to make the dance competitions, and I made 98% of them. So it can be done. I went to many a movie after, a 3-day call and slept through many a movie, but I was there physically. And whoever else is in your life helping you managing this, lean on them, and don't feel bad if they're picking up a little more of the load. I mean, it is what it is. You're out there doing, and they're supporting you doing what you love. My kids are very good now. They're 21 and 24. Great kids because my wife raised them. you know, but I allow, you know, and I allowed that, and she's better at it than I am, but I was at every function, you know, 98% of them. You know, the 2% still kill you, but you know, when you look at the big picture, you know, they can say, hey, dad wasn't at the hospital all the time.
I really sympathize because my first year I was at an art exhibit and it was like it was spring break time in my first year. And I was within a foot of, I think it's The Woman at the Bar by Renoir at the Nelson, so it was local. And it took me half of the exhibit to realize how I was not being touched by the Impressionist paintings that I was looking at that I absolutely dearly love. And it was a wake-up call even then. And as the years passed, I realized that I missed some of me back there because I hadn't been able to schedule some of the things I wanted to do, especially like you said in med school, residency, and that sort of thing. And no, you can't recapture some of those moments with family, those events, those first pregnancies, good golly, but you figure out either a compromise with phone time. Now we've got Skype and all the wonderful electronic tools that can help. It's not the same. Face-to-face, person-to-person will never be replaced no matter what they say. But I also try to, and I have to remind myself, even these days, to go back to the three big priorities: faith, family, and friends. Because finances follow quickly and sort themselves out if you keep those first three as your priorities. And it's flexible. It doesn't matter what your faith base is, but you have to decide what is the most important for you. And some of the major decisions I've made in my life, I've had to stop myself because I was getting as wiggy as anybody can get. And I've just stopped and said, okay, which is the priority here? So it's a juggling act and a scheduling act and so forth, and you may sleep through quite a few things, but you got to work at it. You got to look internally.
Well, I wanted to add something because when we talk about burnout, I think Dr. Hahn said she remembers what it felt like being a first and second year. I know I did. So I would want to ask the panel, if you had to go back and redo any time where you are now outside of when you graduated from residency, would you go back and do it first year, second year, third year, fourth year, or your residency?
I'd do my residency.
He said residency. I would do my residency. What's the one that you would not go back to?
First and second year.
First year. I agree with that. Because
Neuroanatomy.
first
Bingo!
year and
Bingo!
second year.
Neuroanatomy. Dr. Stevens. Love
So-
him to pieces.
So
but-
bottom line is the reason that we were talking about that because we feel your pain a little bit, but all of us have up here are different types of physicians and we have different lifestyles, but we all really almost were unanimous, I believe, here about saying first and second year because you don't see the good. I mean, we could sit here and say, what do you like about being a doctor? Yeah, you may miss out some of the family stuff. I'll tell you in residency, I like they said, we didn't have those hours. And my wife, I didn't want to put my kids in daycare. So I'd work my 36-hour shift and go moonlight afterwards to make ends meet. I mean, I remember falling asleep, at the stoplight sometimes. That's horrible, but that's what needed to be done. I did it. When I came back in private practice, my wife said, you need to go get another job. You're home too much because I picked a good practice. I worked 3.5 days. I mean, literally, it's not a joke. I was used to waking up at 5 in the morning and our first Saturday that we were at our new house, I woke up at 5 in the morning. Well, my family, they're all sleeping like normal people would. I went up and took the Blockbuster movies back, came home. I thought, well, what am I doing? They're just going to be sleeping. Well, I started mowing the yard, and my wife came out and said, what are you doing? And I said, I'm mowing the yard Saturday. It was like at 6 o'clock. She's like, we have neighbors. I'm like, well, they should be up because I was so used to it. It's ingrained. I can't sleep past 5. And so bottom line, kind of what you said about missing your family and all that, it's up to you. And these questions are consistent. Well, how do you do burnout? make sure that you recognize the burnout and you're in control of your destiny, not your first and second year, and not really in residency, but outside you are. What's the number one reason people get divorced? Is financial concerns. We just got done saying earlier that you're going to make way more money than most family of fours live on, unless you start extending yourself and bringing in more responsibility. That, oh, you know what, it might be a situation that if I could go to the movies with the kids or watch a sport game, but I got someone in labor. Maybe if I'll just go ahead and deliver them, because otherwise I'm going to lose out on some money. Well, that's not the practice I'm in. Is that my patients understand that, hey, I've got a life too. Because ultimately, when you're doing stuff above and beyond for your patients, you're going to let them down. There's a saying that everything in life is a success or failure based off level of expectations. I know a personal OBGYN that gives her personal home phone number to her patients. You think, oh, that's nice. She's been sued more because when she's gone, they want to get a hold of her. Now her doctors will let them down.
That's right.
So bottom line is you got to make that division a little bit. And ultimately, if you went up here and asked me, would I do it again? 100% I would do it again. I'm within that 50% because I really haven't experienced burnout yet. And I'm planning that, hey, listen, with my retirement and all that, I could retire early if I wanted to, because the money that I make now is based off the decisions I made then. And hopefully, I mean, I want to bring the optimism up a little bit, because you guys, first and second year, you've got plenty of fun stories coming. Your third and fourth year, like Hubbard said. The enthusiasm that you bring. I remember the first rapid strep I did, I was excited. And they're like, why are you excited for rapid strep? I said, well, it never comes back positive. It's always negative. And I went to a didactician and came back, and they said, look, it came back positive. I mean, everyone's excited about it. Medicine's awesome, and your life is awesome. I remember sitting in this neighborhood, and people said, well, tell us about your day. The accountant may say, oh, I almost balanced to the penny today. Tell me what you did. I could have a great story that there's no way you can always your stories are going to be incredible. People let you touch their heart. You see them at their best and you see them at their worst. And is that worth it to me? 100% is worth it to me. I'd do it all over again, even going back to first and second year. Especially second year with repro. That was awesome.
Little plug there.
You
right.
wouldn't say neuroanatomy was that great? I'll tell you guys a true story about neuroanatomy when I was going through. Now, we're going back almost 35 years here, okay? I was on the neuroanatomy practical. Like all of you, I had Dr. Stevens. It was his second year out of his postgraduate stuff. And so he was doing the neuroanatomy practical. I came to a spot on the one skull where we were supposed to name the foramen, and we'd write it in. I knew that if I stood there for an hour, I wasn't going to be able to come up with it. Skull I had in my bone box sure didn't have that foramen in it, so I don't know. And I thought, I bet he just took out a drill and went, set it out there, labeled it, said, name it. That's really what I thought. Well, I've got like a minute, right? So I thought, that's what I'll do. I don't know what it is. Make a guess, right? So I wrote foraminus blackendecorus. It was fortunately the only thing I got wrong, but he wrote in the margin, very funny. So just so you know, a stressful time, but you're going to look back on these things, and the tough parts of this over the course of time will tend to fade a little bit, and you're going to remember the good times. You're going to remember those times where, you stayed up late telling each other jokes and challenging each other over things, and it's not going to feel as painful as it feels now. You'll still remember being fatigued. You'll still remember being pushed beyond your limits, but you're also going to remember that this is a really good time in your life because you got to learn a ton of information, and then you went out and used what you learned to help other people. So, remember to take the good with the bad.
All right, I know that we're running a little bit over time. We did have one final question that we wanted to get asked, and we'll go from there.
Dr. Hahn, earlier you mentioned that you should be wise about who you choose for your spouse or partner. What are some of specific aspects that y'all looked for in your spouse? And also along with that, you guys did, I think all of y'all told us a bit about your families, but could you share some arguments or conversations or changes that you guys have had to make over the years to make your marriage or family thrive and work?
Well, I'm one of those crazy people. I married at 21. So I married before I entered medical school. My husband was 23. He saw me through medical school. He cooked. The only loan money I took out was for tuition alone. We lived on what he made, and it wasn't a lot. He stayed in a job he didn't like for almost 14 years, and then I put him through seminary. So we lived through medical school, we lived through residency, we lived through having kids through that, and then we lived through seminary. The divorce rate, at least when I went through medical school, is if you were married when you started, it was 50-50. Seminary is about the same. So we've managed to survive that. We're very intentional about spending time together. We actually are part of a group called Better Marriages, which is a non-religious group, but encourages you to talk about what's important. It's all about intentionality. We try to have a date night, or at least a meeting with close pastoral friends that have the same basic priorities. We make sure we spend time with our families. Neither of us came from rich families. I didn't marry somebody that had an expectation. The first job I had, I worked for a year between college and medical school, and we married before that year. As soon as I graduated college, we married a week later. And that year, I think I made a gross salary of $12,000. So my husband had very low expectations, and I had very low expectations monetarily for what he was going to do. So our marriage was not based on that. I have known many physicians who have married a spouse who married them basically because they made a lot of money. I'm just being honest.
Or the potential for making a lot of money.
Right, the potential.
So it's hard. It really is, because you don't know. You can tell somebody, I'm going to be busy for 4 years in medical school and 4 years or so in residency, but until you actually live it, it's very hard. So it's a matter of, from the very beginning, having realistic conversations, honest conversations about what is the lifestyle going to be during these processes, and what is our goal long term. And I can say that because I'm on my second marriage. My first marriage, I got married in between my first and second year of medical school. And I thought I had had those conversations, but I guess I hadn't had them realistically enough, because there was an expectation after residency that, well, you're done, so now it's an 8-to-5 job. And so those that are not in medicine don't realize what medicine is schedule-wise. It's not an 8-to-5. But when all the other families around you, everybody goes to work at 8, comes back to 5, they're all playing in the backyard with, everybody else's kids, that kind of puts pressure internally in the family. So those conversations happen now. What are your expectations? What is it that you want out of the marriage? What is it that you see our marriage going? If money and the house and the car are part of that conversation, that's where the trouble starts. So it really has to be a conversation about us, about where are we going to be, how many children do we want? What's our family going to look like? That's why I always stress, where are we going to live? Are we going to be close to your parents, my parents? What's 15 years from now, where are we going to be? And it has to be more about us than it has to be about the house, the car, and the money. So that's the only warning I have to put out there, is you really have to have some very, very deep, honest conversations with your significant other about what the future is going to be.
Believe it or not, I had that conversation with my husband on the first date, and he will tell you that. I said, Jeff, this is where I'm going. If you don't want to come along for the ride. We'd known each other. We knew we were musicians. We knew we had a lot of compatibility. And I just said, this is where I'm going. And I'm never going to be a stay-home wife. I'm never going to be somebody that's going to be able to be at all the ball games and all the music events and all of that. I said, it's a lot of hard work. And if you don't want to come along for the journey, bail now.
There's no second date.
That's right.
There's no second date.
I really did.
That's awesome.
That's great. Yeah, I don't think I've ever had that conversation on a first date. But I'd say this, second date, like he said, communication is huge. And, marry somebody who's got the same work ethic you have, because they're going to be working hard to maintain everything at home. and they know that if they need to pick up slack, they will. And, you know, when I opened my own practice, guess who my office manager was? My wife. You know, I mean, who else do you want handling the money than somebody you trust? And there was a period of time where she was gone for a couple months, and from the practice, I couldn't function without her there. So, you know, there's, you know, it sounds kind of, you know, nonchalant. Marry your best friend for sure, and have open communication. And if they're willing to work as hard as you are, it'll work. It's like Sarah said. She worked. You know, her husband carried the load, and then she carried the load, and they're both very hard workers. And because if you have somebody that thinks they're just going to sit back and go to the spa every day and get their hair done, and the kids get all this, and you know, while you're out busting your ass, it's not going to work, because you're gonna feel taken advantage of, and you're gonna be very resentful, and you're gonna be mad about it, and that ends up, you know, ruining the marriage. So I think it's all about hard work, and if you're both in it together, like Sarah had the discussion, then it's great. And communicate. It's not rocket science, though.
No, I kind of feel the same sentiments as they said. I met my wife when we were in high school, so we've dated forever and then got married, etc. I didn't know what it was like to be a physician. I had no idea how hard it was going to get into medical school. I applied to 2 medical schools, and when I interviewed for here, when people were sitting around and over at Smith Hall, and they were saying, "Well, what do you do?" "Oh, I'm a phlebotomist. I do this." I'm padding their CVs and doing all this extra stuff. Someone said, "Well, what do you do?" And I said, "Well, I'm a bartender." And literally, that's what I was. I mean, I didn't know any about medicine. I had a BS in biology, but I was a bartender. So one of the things that I didn't understand is sit down with my wife and say, "Hey, listen, this is what I'm going to do and what it's going to take." And so when we are up here, we all have different journeys. So we have some residents, if you go in certain residencies, it's really nice. I mean, some residents are really nice. Pediatricians are nice. Family practitioner residents are kind of a nice residency. And so yeah, any surgical field, gen or OB/GYN, sometimes they're not. But also, I don't have the mentality as when I was in a fraternity, someone spanked me, so I can't wait to spank someone else. That's not I don't want any part of that. I want to rise better than that. So when someone comes and talks to me, you can keep on that pathway, and it's a self-destructive pathway. So if you're finding pleasure in being mean because someone's mean to you, I've experienced that as a 3rd year and a 4th year. I can give you concrete examples of that. I didn't appreciate it, so I don't do it to my residents or my students as well. So bottom line is, how do you find a spouse? Geez, I don't care what field you are. That's a great question. Who knows? You know, and now you can go on eHarmony and check some stuff, and maybe that's a who knows. Bottom line, find your friend, and then those will come back. That'll come back to you. And remember how I said sometimes it's hard to get a life balance? When I was in residency, we always said, we're going to go to 4 years residency, and we're going to come back to Kansas City. That's where we met. That's where our families are. That's all of our friends. Met in high school, yada, yada, yada. And they approached me end of my 3rd year, coming in my 4th year. Some MFMs took me out and said, "Hey, we're going to start a fellowship program here. We want you to be the first fellow, or pioneer fellow. It's going to be through Ohio State and all. It's a big honor." And so I was like, "Oh, I love these attendees. It's going to be great. It'd be fun." I went home to my wife and said, "You know, this is what happened at dinner. They want to start a fellowship." She said, "Well, how much longer?" I said, "It's been a few years. I love these Dr. Kroom and Dr. Sonic." She said, "Well, I thought our plan was going to go home." I said, "But it's kind of nice. I'd be the pioneer." And she said, "Well, is there a fellowship in Kansas City?" And I said, "No." And she said, "But if there was one in Kansas City, you'd want to do it?" And I was like, "No." And so you need a friend to kind of reel you back in, because in medicine and in any profession, once you start getting at the top, you're going to be asked to do more and more and more, and pretty soon you're now excluding your family and excluding people that helped got you there. Sarah's example is good. Her husband helped her, she helped him. And same thing with my wife. So I think it's just a team approach.
Yeah, I'd agree completely. Marry your best friend. My wife and I were best friends for a year before we started dating. We were very, very close in college. She's my college sweetheart. And I kind of knew I was in the right place to begin with, because, you know, you're trying to make a good first impression, you know, and actually impress her by saying, you know, I graduated 41st in my class. Well, there was like 650 in our high school. So 41st was nothing to sneeze at. And her comment was, there were 39 in my graduating class. Like, "Bub, you didn't even make the first cut Okay, but she didn't kick me out. She didn't chase me off. She didn't ignore me. Turned out that she just wanted to be my friend. Why? Because she liked me. And I was the same way with her, that because I liked her and we actually liked each other. And when we started talking and growing closer together, it was about making sure that we were on the same life path together. Are we walking the same walk? Are we talking the same talk? There were lots of people, I'm sure, that were much more studly than I could ever hope to be, that tried to court her, but they weren't on the same walk together. And so we have been on this same journey. It'll be 35 years on June 12th. Yes, I remembered. I've got this thing called a smartphone. But we'll be together 35 years as husband and wife on June 12th. One of the things that I found that's advantageous is that she sometimes thinks differently than I do about things. And she has the poop detector. She's really able to detect the poop in something. When we're trying to think through a problem together, she can tell me where all the poop is. And, to me, I kind of gloss over it. I may not always see it. Man, she sniffs it out and she says, well, I'm concerned about this. I'm concerned about that. And I'm concerned about the other thing. She thinks differently than I do about problems, about issues. And she tells me that she gets that from me as well. So we've got the ability to complement each other and to think differently about things, offer perspectives on things that are different, so we make a better decision together on just about anything. And so all of a sudden you kind of go through life together and you realize you've raised a son who's gotten married, and he kind of found his wife the same way that we found each other, and you go through things. So hey, maybe this is not such a bad way to do it. So I think if you make it a little bit less about, well, gosh, it's just got to be like it is in the movies, it's got to be Romeo and Juliet, or I'll just die if I don't get it. Well, I got news for you. There's a story called Romeo and Juliet. Remember what happened to them in the final scene? That's going to happen to your marriage too if you're not real doggone careful about that. Really, all this is just two old people that get lumpy and live together for 50 years, and before they know it, they've done life together, they've raised families together, and they've got grandkids and maybe great-grandkids, and they've made some really terrific decisions, and they can't imagine doing life any other way. That's really what marriage is all about.
And at the end of the day, you heard in all those, in everybody's comments, it's the person-to-person interaction. That's what it's about. It's finding that person that you relate to, that you can live your life with. All the other stuff's secondary. The money, the house, and all that, that should not be the priority. Just listen to the conversations that you've heard. It comes back down to your significant other should be not just a significant other. It should be your friend, should be your confidant, should be your partner.
And with that, I wanted to thank you guys all for coming. Thank you for staying. And please help me thank our panel members for coming and talking tonight.